Hi, welcome to another Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley, the dermatologist here at the hospital, and I've got our special guest, Dr. Stephen Stockdale, a board-certified surgeon here to talk about everything about minimally invasive surgery. And I'm super excited for this topic because it's actually something that's really not discussed to veterinary students during our schooling. It's kind of brushed over, and I think it's something that's very interesting, and a lot of owners ask about it too, as an alternative to certain types of surgery. So we're going to be talking about everything about minimally invasive surgery, and as always, this is a discussion, so if you have questions, feel free to chime in. Denali will be helping you with those, and we'll be happy to answer your questions during and of course after the discussion as well. But I'll get us started on talking about, so there's different types or versions of minimally invasive surgery. Can you go over those to get us started?
Yeah, I mean, in general, I think that really the goals of minimally invasive surgery are to be able to achieve similar goals of open surgeries, but with smaller approaches and hopefully gain some advantages that we would maybe not get with an open surgery. And so kind of broad categories would be, things that are common for people, I think, is anything involving looking in joints, because a lot of people have had knee injuries or maybe knee procedures themselves, and so arthroscopy would be a common version. Some of the things that...
And so that's like when somebody would say, we're going to scope the knee or something, that's basically what we're referring to.
Exactly, yep, exactly. So putting a scope inside of a knee, being able to do your exam, and then also treatment in a lot of cases as well. So that's one category. Another would be looking inside of abdominal cavities or thoracic cavities, so thoracoscopy or laparoscopy. And so that's another modality that we use as well. And so we can achieve a lot of different procedures by being less invasive in that manner as well. And then there's some other categories where you start getting into vascular surgery, working in through blood vessels and things like that, that people who've had coronary artery problems or anything like that might be familiar with. So that's another category as well that would be technically included in a minimally invasive category.
Okay. And are any of those categories not currently being utilized in veterinary medicine, or are we capable of doing every one of those?
They're all possible in veterinary medicine. I think that it's an expanding aspect of our field, and definitely very commonplace in human surgery, and we're trying to adapt similar protocols as well. So I think veterinary medicine is always just slightly behind, and so we're working to catch up and working with those different professionals on the human side to learn their techniques as well. And to be honest, it's catching up pretty quickly. And certain facilities, need some specific equipment for some of the big vascular stuff, but laparoscopy and arthroscopy is much more attainable these days than it used to be. There's quite a bit more training to make it possible for surgeons and honestly some general practitioners as well.
Okay. Is there any certification for this, or is it just people who have gone out and done extra training for it? Nothing.
There's some specific certification. I don't want to say certification, but there's specific training programs that will teach you these techniques. It's not necessarily something that you want to just try for the first time on a patient, because that would be a very steep learning curve. So quite a bit of practicing with the instrumentation, because it's very specialized, and so there's courses that will work on models and computer simulated practices, sometimes cadaver work and things like that. Ways basically to practice over and over and over to learn the techniques before you ever see a real patient.
And of course, the advantage of you being board certified is you've done a residency and you're learning this stuff throughout your residency.
Correct. So fortunately, in my training during residency, we were doing this quite commonly, and I had mentors who were capable of doing that, and so I got exposed to it pretty early on, which is great. But I'd be honest that it's something you want to keep up on. So I still go to new training programs as the years go on to keep up on these types of techniques, because even what I've learned in the past, it's an ever-evolving thing, and there's always new techniques that you want to learn as well, and so it's not something that you just stop learning at some point in time. It's ever-evolving.
Interesting. All right, and then what are the typical procedures that you would do, or maybe that a general practitioner might do, that would be offered in a minimally invasive way?
I think some of the most common, probably the most common procedure would be arthroscopy, which is something we do quite commonly here, whether it's working in knees or elbows and shoulders. These are the common joints that we're working with. With regards to laparoscopy in the abdomen, probably the most common would be ovary removal to sterilize female animals. So spay would be the common term, and that's something that's very attainable and quite a good technique as well. It's very easy on the patient and makes their recovery quite smooth and less invasive than a major abdominal surgery. So that would be probably your most common.
Okay.
And then we do some other prophylactic procedures. Large breed dogs who are prone to bloat or GDV, we can actually do prophylactic tacking procedures where we anchor the stomach to the body wall so that it can't twist on itself for that specific condition, and some breeds are predisposed to it. And when they're younger animals, owners are inquiring about having that procedure done to prevent an emergency in the future. And that can be combined with a spay procedure if that patient needed it at the same time, which can all be done in a minimally invasive manner.
Yeah.
And then things can get more advanced as the case needs it. Some complex tumor removals and gallbladder removal, things like that people are probably familiar with as well, because gallbladder removal in people is very commonly performed with laparoscopy instead of an open surgery these days. And it's great that we can offer that for our animals as well.
Absolutely. And you already kind of said a few of the benefits here and there, but can you summarize the benefits of minimally invasive surgery over a typical approach?
Yeah, I think that one of the major benefits is going to be that it's easier on the patient, and that we don't have to do a larger open surgery where we're making bigger incisions and causing more discomfort for them. And so, for instance, with arthroscopy, this is a typical arthroscopy camera, and this is the size of the port that's going into the joint itself. And so we can put this camera into a joint, whether it's a knee or elbow or shoulder, and be able to evaluate or look inside of the space itself and the structures, and both investigate, get our diagnosis, and then treat at the same time. So a smaller approach is less painful for the patient. The other beauty is that there's a lot of magnification that comes out of one of these instruments, and there's a camera that attaches here. It's projected on the screen that we can magnify everything, and so we get these very beautiful images, I guess, that are very high definition and allow us to really thoroughly investigate structures that, to be honest, with the naked eye, sometimes we can't evaluate as well. So I think the magnification is very helpful for these procedures. When we're working inside of an abdomen, we're working with a scope that's longer just because we need to work in a bigger area, but the diameter of it is actually quite small. And the beauty of this is that it has this angle at the end of it where if I spin this scope inside of a body cavity, we can actually start to look around corners and things like that and reach hard to reach places that we may not be able to do in other instances. So less invasive, further investigation, and there are some cases where we've done pretty extensive testing, whether it's an ultrasound or a CT scan or something, and there are some cases that are stumping, and where we get to a point where we really need to more or less investigate by looking internally.
Take a good look in there.
And there is a benefit to sometimes just putting something as small as this in, looking first, and then deciding, do you really need to open this patient up further to do a big procedure, as opposed to doing something more invasive. If that makes sense.
And you've got some more toys there.
Yeah, so this is the scope that I was showing you before. This is actually the way that we get access to a cavity, whether it's the abdomen or the chest. And so this would actually go through the body wall, and it has these threads so that it doesn't move back and forth. And then it allows us to put these cameras in and out through these actual ports here. And these are all air sealed because when we're actually working inside of something like an abdomen, we need to inflate it and make working space. So we're actually pumping gas into the belly so that it inflates and we have the ability to look around. And these have very special valves that don't let that gas back out, essentially. So pretty cool instruments here, and you can use multiple of these in a single patient, or sometimes we only need one, or sometimes only two. And so kind of cool. And then with the same port, we can, once we've actually used a camera to evaluate and look around, we can add extra instruments basically through other ports to actually achieve whatever goal we're using. So this would be an example of a grasping instrument that allows us to dissect tissues or grab tissues and move them around in different ways. They all rotate around so that we can manipulate tissues in different planes while we're working within a patient, and achieve some pretty incredible things through very small incisions.
Neat.
And all of these can also be used in the chest cavity as well. So there's some techniques that we use there. We're fortunate that the chest has a cage around it, the rib cage, so we don't have to inflate the chest. It kind of has its own structure, and so we're able to do a lot in there without having to pump any gas or anything into those patients. And really, it's pretty incredible how well they tolerate it and bounce back, and we find ourselves using a lot less pain medication for these patients because we haven't had to be as invasive, and I think it makes their recovery much smoother. So in my mind, I think this is an area that is underutilized in veterinary medicine. I think that on the human side, it's becoming more mainstream, and people are being offered it, people are asking for it, and we want to be able to do that as well. And so there are definitely some cases where it's not an option for multiple different reasons, but there are quite a few cases where it is a very good option, but perhaps people don't know that it even was. And so that's our goal, is to educate and be available for consultations on things like this so that we can discuss it further.
Perfect. And I guess what would be, you know, if you could say like one surgical procedure where you wish people would know, like this can be done in a minimally invasive way and it works super well, what would that be?
Honestly, I think gallbladder removal is quite a nice technique with this, and there's a lot of crossover between people and animals, but there's a lot of dogs who need gallbladders removed at an older age, and they tend to be kind of sitting in more of the geriatric age group where they're older, and having a bigger procedure to open up an abdomen and remove something like that can be hard on them, and we can achieve this, removing something like that that's problematic, and make it very easy on them. And I think that it's something that hasn't always been an option, and it does take training to be able to do it well and have it go well, and fortunately we see really good outcomes with those cases. And so I hope to see those more performed in a minimally invasive manner than an open surgery if possible.
Yeah. Great. Well, thank you so much. It's been great having you on the show. And as always, for our people watching at home, you know, if you have any questions about this, or if you have a procedure that you're curious about, is this a way we can do it minimally invasive? Definitely, you know, write a comment on Facebook, and we'll be happy to reapply for that. But thanks for joining us.